Let's talk about the waiting time in the NHS. Now, for the purpose of this video, we will be referring to the handbook to the NHS Constitution. And in the handbook to the NHS Constitution, it is clearly mentioned that the patients have the right to access certain services commissioned by NHS bodies within maximum waiting times, or for the NHS to take all reasonable steps to offer the patient a range of suitable alternative providers if this is not possible. Okay, so the patients have the right to start their consultant-led treatment within a maximum of 18 weeks from referral for non-urgent conditions. Patients have a right to be seen by a cancer specialist within a maximum of 2 weeks from GP referral for urgent referrals where cancer is suspected. If this is not possible, the CCG or the Clinical Commissioning Group or NHS England, which commissions and funds treatment, must take all reasonable steps to offer a suitable alternative provider, or if there is more than one, a range of suitable alternative providers that would be able to see or treat the patient more quickly than the provider to which the patient was originally referred. A suitable alternative provider is one that can provide clinically appropriate treatment and is commissioned by a CCG or NHS England. The patient will need to contact either the provider the patient has been referred to or the local CCG before alternatives can be investigated for the patient. CCG or NHS England must take all reasonable steps to meet the request of patients. The patient's right to start treatment within 18 weeks from referral will include treatments where a consultant retains overall clinical responsibility for the service or team or for the patient's treatment. This means the consultant will not necessarily be physically present for each appointment but will take overall responsibility for patient care. The setting of consultant-led treatment, for example, whether hospital-based or in a GP-based clinic, will not affect the patient's right to start treatment within 18 weeks. Now, there are exceptions to the situation. The right to treatment is subject to various exceptions. In particular, the right to treatment within 18 weeks from referral will cease to apply in circumstances where the patient chooses to wait longer, where there is a delay regarding the start of the treatment in the best clinical interest, for example, where smoking cessation or weight management is likely to improve the outcome of the patient treatment. In situations where it is clinically appropriate for the condition to be actively monitored in secondary care without clinical intervention or diagnostic procedures at that stage. In a situation where the patient fails to attend appointments which you had chosen from a set of reasonable options, and in situations where the treatment is no longer necessary. The following services are not covered by the right. Services that are not consultant-led, services like maternity services, public health services provided or commissioned by local authorities. Now, what is the source of this right? Part 9 of the National Health Service Commissioning Board and Clinical Commissioning Groups, Responsibilities and Standing Rules, Regulations 2012, as amended from time to time. The NHS commits to provide convenient, easy access to services within the waiting times set out in the handbook to the NHS Constitution. All patients should receive high-quality care without any unnecessary delay. Patients can expect to be treated at the right time and according to their clinical priority. Patients with urgent conditions such as cancer will be able to be seen and receive treatment more quickly. Organizations' performance is monitored across all waiting time pledges. There are a number of government pledges on waiting times, including a maximum 1 month, that is 31-day wait from a decision to treat or earliest clinically appropriate date to treatment of cancer, a maximum 2-month or 62-day wait from receipt of an urgent GP or other referral for urgent suspected cancer or breast symptomatic referral or urgent screening referral or consultant upgrade to first definitive treatment of cancer, a maximum 28-day wait from receipt of an urgent referral for suspected cancer, receipt of urgent referral from a cancer screening program, or receipt of urgent referral of any patient with breast symptoms where cancer not suspected to the date the patient is informed of a diagnosis or that cancer is ruled out. A maximum 4-hour wait in A&D from arrival to admission, transfer or discharge. Patients waiting for a diagnostic test should have been waiting less than 6 weeks from referral. A maximum 7-day wait for follow-up after discharge from psychiatric inpatient care for people under adult mental illness specialties on care program approach. All patients who have operations cancelled on or after the day of admission, including the day of surgery, for non-clinical reasons to be offered another binding date within 28 days or the patient's treatment to be funded at the time and hospital of the patient's choice. 75% of people referred to the Improving Access to Psychology Therapies programs should begin treatment within 6 weeks of referral, and 95% of people referred to the IAPT program should begin treatment within 18 weeks of referral. More than 56% of people experiencing a first episode of psychosis will start treatment within a NICE recommended package of care with a specialist early intervention in psychosis service within 2 weeks of referral. All ambulance trusts to respond to category 1 calls in 7 minutes on average and respond to 90% of category 1 calls in 15 minutes. Respond to category 2 calls in 18 minutes on average and respond to 90% of category 2 calls in 40 minutes. Respond to 90% of category 3 calls in 120 minutes. Respond to 90% of category 4 calls in 180 minutes. In addition, local authorities with public health responsibilities should bear in mind that it is best practice for the care of patients and their sexual partners to offer genitourinary medicine appointments as soon as possible, and that the clinical evidence indicates a maximum of 48 hours. More information on the 31-day cancer waiting time. 1 month standards for first and any subsequent cancer treatments have been combined into one measure from 1st October 2023. For all first treatments and many subsequent treatments, the start of this date will be the decision to treat date defined in NHS England's guidance for monitoring and recording cancer waiting times as the date the patient agrees a treatment plan, that is, the date that a consultation between the patient and the clinician took place and a planned cancer treatment was agreed. For some subsequent treatments that are the next phase of a pre-agreed plan, the earliest clinically appropriate date is used as the start date for this period of treatment, defined as the earliest date that it is clinically appropriate for the next activity that actively progresses a patient along the pathway to take place. This allows for the appropriate clinical management of patient pathways and for appropriate recovery time between bouts of often taxing and invasive treatment. So you see, there are explicit guidelines regarding not just the waiting time for patients to receive care, but also the time within which ambulance needs to respond to calls from patients.